Right. Well, welcome everybody, and thank you for coming out on such a beautiful evening in Saskatoon. I think for all of us, it's hard to sit inside when it's so nice outside, but this is a topic of great passion to me, and I'm hoping that it'll be of interest to you as well. And it's around preventing falls. When I heard that I've been doing research in this area for 39 years, it made me feel very old. I actually am retiring this year, but I will be continuing on with a lot of my research. I have a lot still that I want to do. So it gives me great joy to be able to find some ways that might help people prevent falls. So strong, balanced, and planted, and that'll make more sense to you as we get near the end, why I've chosen those words. And as Karen said, I'm from the University of Saskatchewan and a physical therapist. So what we're going to cover tonight, three main objectives. So I'm going to talk about the most common fall risk factors for people living with dementia, but also for older adults in general. And then I'm going to talk about some practical ways to prevent fall-related injuries, which is why we're so concerned about falls. It's not so much the fall itself, it's the injuries that happen as a result of a fall. And then we're going to share and practice a very simple at-home exercise program called Plant. And I'm going to tell you where that video is because it's also a fairly recently produced video that you can follow along on your own. So one of the first things that's important to get started before we talk about what the risk factors are for falls is understanding what a fall is. And most of the time, falls are underreported. People lose their balance and they don't think that it's a fall. And so for us, healthcare providers who are interviewing and trying to understand when a fall happens, we have to probe quite deeply to find out the information, because often we shrug it off and say, yeah, it was nothing. So a couple of key words. This is the definition from the World Health Organization about fall. It's an unexpected event, so it's not something that you do purposefully, and it's where an individual comes to rest on the ground, floor, or lower level. And this is where it gets confusing, I think, for some people, because you may think if you lose your balance and you sit back down in your chair, or you lose your balance as you're walking down the steps and you just sit on the lower step, that isn't a fall, but that is a fall. We also can talk about near falls, where you do tend to lose your balance, but you're able to catch yourself. And those are the things where, you lose your balance and you're just very lightly able to touch a wall or a railing and you don't lose your balance. So those are near falls. Both of those things, falls and near falls, are a red flag. That they are one of the main things that tells us that you are at risk of a future fall. So if you've had a fall and you haven't injured yourself seriously, it should still be a warning signal to you that there may be something that you've got some risk factors that you need to address. So I'm going to talk a little bit more about those risk factors. It's very complex. There's hundreds and hundreds of fall risk factors, and you may not even know that you have some. And they all tend to work together. So if you have one fall risk factor, it may not be such a big deal, but if you have 4 or 5, then they work together and can put you at greater risk. There are 3 main ones other than the history of a previous fall, which I just talked about. And those 3 main ones are balance, and that I'm sure makes sense to everybody, walking ability, and muscle strength. Those are the 3 main ones. The good news about those is that those are things that you can fix. There are things that you can practice. They are things that you can get better at, and that can help to decrease your risk. Other kinds of risk factors like age, conditions that you have, those are things that you can't change. You have to live with and understand. So the other fall risk factors, and I'll talk a little bit about a few of these. Use of a walking aid. A walking aid can be a help and preventing falls, but it can also be a hindrance if they're not used properly or they get in the way. Footwear, incontinence, if you have to pee frequently, that's a risk factor. Certain medications, particularly ones that have side effects for dizziness or drowsiness. Fear of falling. And you may think, well, that's maybe a good thing. If I'm fearful of falling, I'm more cautious. But a fear of falling actually creates a real spiral where your fear may decrease your social and physical activity. And in turn, then that decreases your muscle strength, your balance, and it becomes a real cycle of fear. Vision is important. Hearing I've put in there, but mostly that's more to do with the inner ear. If you have inner ear problems that give you some, vertigo, which like the room is spinning, or dizziness, those certainly can impact your balance. Other conditions such as arthritis, and neurological conditions such as Parkinson's. Cognition, and certainly for people living with dementia and Alzheimer's, that is an impact. I'm going to talk a little bit more about some of the factors there. Nutrition, and particularly hydration. If you're dehydrated, that can tend to increase your risk of falls. And an environment, and there's lots of things in the environment we know increases our risk. So in general, 1 in 3 older adults who live in the community will fall every year. And I bet if I had a show of hands here, probably at least that are going to tell me they had a fall in the past year. For older people living with dementia, you are at 2 to 3 times higher risk of falling and a higher risk of injuring yourself. So the big 3 fall risk factors, I'm going to walk through each one of these in turn. And as I said, it's a complex kind of mix of factors and how those interact. And I know that when I talk to people who have fallen, there's often a lot of guilt around the fall, or shame that you may feel. You don't want to talk about it. You don't want to let your family member know that you've fallen, because they'll become concerned about you, and maybe, it shows a loss of independence. So there's lots of things that I think circle around people's heads when they fall. And then lots of, why did it happen? Well, it was the ice. The ice was there and it wasn't cleared off the sidewalk, and that made me fall. Or was it my balance? Or was it because I was talking on the cell phone at the same time? So all of those factors, kind of link together, and usually it's a combination of something, and it's not easy to sort out yourself. And that's sometimes where you need some help in terms of someone with some professional skill set. And I'm going to advocate for physical therapists who know about how to assess these factors and identify, what the risks are for you. There are some signs to look for, though, and these are specific to people living with dementia. These are some early signs that you may notice for someone that's going to be at risk of falls. So a little bit of unsteady walking, shorter steps, sometimes dragging feet, bumping into things, stooped posture, and turning with short steps instead of pivoting around. So those are some things that are subtle and sometimes seen to identify that there may be some risks there. So I'm going to go through each of these big 3. And of course, balance is one of the big ones. And that obviously makes sense. If you lose your balance, you fall. If you can't keep your balance, you fall. And so balance is that ability to really stay within whatever base of support you're on. Whether if you're sitting in a chair, it's your legs and your bottom. If you're standing, it's your feet. And if you're moving and walking, it's 1 foot at a time, because the other one is up. So each of those are progressively more challenging for your balance. So there's some things on the left side of the slide that I've identified that could be part of dementia and some of the factors there. So medications is one, and I'm no expert in all of the medications that people may be taking, but you need to look at the side effects and also check with your pharmacist or your doctor what some of those side effects are and when those may come. If it's right after taking the medication, if it may be delayed, and how serious they may be. Some of the side effects to be careful to look for are things like dizziness, drowsiness, urination, increase in frequency, because that tends to cause you to rush to the bathroom, and that's often when people experience a fall. Cognitive function, and I'm going to talk about cognitive function and what we call multitasking together. So an activity where you're having to challenge your balance, and I'll use walking as an example, may be fine in a familiar setting. You're in your home, you're not going far, you're going from the kitchen to the living room. But when it becomes more challenging for your balance, if you're adding something else that you have to focus on, so maybe you're talking to someone now as you're walking, maybe you're carrying a cup of water, or maybe you're outside and now having to navigate, some rough ground you're unfamiliar with. Those increase what you have to do cognitively to be able to maintain your balance. And that's where a lot of challenges begin to come in. Posture, strength, and mobility. And we're going to talk about all three of those because those are really key to keeping your balance. So how can you address those? Well, as I said, checking side effects, practicing dual kinds of tasking types of activities in safe settings. And I know Minds in Motion, for example, does practice those kinds of activities, making the environment safe. And then exercise is important to address these factors. So posture, key to balance. So we're going to actually practice posture a little later on tonight. I think often people think, well, posture is not really an exercise, but it is. It's probably one of the most important exercises, and one of the most important exercises you should do before any other exercise that you start doing. Because if you can keep your body in the right alignment, it makes the muscles most efficient, but it's also going to put you in a position where you can keep your balance the best. And if you think about poor posture, and we all see it, and often there's a tendency to slouch forward more is one that you see. As soon as you do that, it takes your balance away from that base of support where you're stable. And it puts you at risk of losing your balance. And it may not, be a factor if you're just standing still, but let's say you're walking in the mall and someone bumps into you and you're not prepared for it. If you're in a position or a posture where you're already a little bit off balance, you're less likely going to be able to catch yourself and retain. If you're in a better posture, then you're putting yourself at the most efficient, the best your body can be to be able to react. And so that's why it is so important, and practicing it and cueing it if you're a caregiver, giving cues frequently. So we're going to practice that in a little bit. Practicing balance. So research tells us that you need to practice balance 3 hours every week to be effective and to improve your balance and maintain your balance. Now that may seem like a lot, and you may think, well, I don't have time to go to a class 3 hours a week to do balance exercises. And so you don't have to. Balance can be practiced frequently during the day in day-to-day activities, and you are accumulating these 3 hours over the course of a week. And so, for example, in one of these pictures, I have a woman who's standing at the kitchen counter. She's washing dishes. Perfect place to practice balance. It's safe because you've got a steady counter right there. And you can shift from one foot to the other. You can, tap one foot back and then forward. You could practice, balancing on one leg and then shift to the other. As you're washing some dishes or doing something in the sink, which is also multitasking. You could also do at the kitchen counter, practicing reaching towards the cupboards, or just practicing turning your body. So, there's lots of ways. Sitting and watching TV. Sitting, you can practice balance just by shifting again from one side to the other side, just turning your head from side to side, turning your trunk from side to side, reaching one arm up, reaching the other arm up, stretching sideways. Those are all balance types of activities. So any kind of movement as you're in a stable base is going to practice balance. And so I really encourage you, motivate you to think creatively, because I think there's lots of ways that even I haven't thought of that you might be able to just challenge balance safely in day-to-day activities. And then certainly advocating for, getting involved in some type of activity class. And I'll talk about some at the end of the presentation, where there is someone teaching and helping to take you through some steps to challenge your balance. All right, walking. So walking, actually, changes in walking is one of the earlier signs and earlier stages of dementia that they found. There's been some research lately that has sort of looked at fairly subtle changes that can happen in the early stages. So those are things to watch for, because it's a sign that you may have to be a little bit more careful and address some of those things to decrease falls. So some of the factors, as I said, distractions and multitasking. Often people will find they're more at risk as their environment changes, something that's unfamiliar. And I know we did quite a bit of our testing for the Minds in Motion program in the field house, and both caregivers and participants would tell us, sometimes just walking into a different setting, having to go down the stairs or down the ramp, into a different room, unfamiliar, just felt more scary and challenging. And those were, times that they felt that fall risk was much greater. Complexity using walking aids. And I'm going to talk in the next slide about canes and walkers, because they're the most common ones that you see used. As I said, walking aids can be great and they can be not so great in terms of fall risk. So walking aids are not simple to use. I'll just maybe put that out there for a start. You can go into any pharmacy, you can walk into a store that has daily living kinds of aids and get a walker, get a cane. Sometimes people borrow them from friends or neighbors, and you just set out and try to use them the best you can. But they're actually, they need to be used the right way to be safe. And it's another complex task. So you're adding in multitasking again. So walking can be challenging enough for someone living with dementia. And then you're adding in the complexity of how to use this walking aid and making sure that it doesn't get in the way and create more risk. So sometimes it can be really important to get some help in the right way to use the walking aid. And there are times when maybe it is not the best choice for someone if they can safely maneuver in other ways. And as I said, new environment safety. So what on the right-hand side can you do to address those? Well, practicing the dual tasking, making the environment safe, monitoring the use of walking aids and see a physiotherapist to determine if it's appropriate, and making the home safer. So I'm going to talk a little bit about walking aids. A pet peeve I teach physiotherapy students, haven't so much lately in my role as director, but one of the things that I used to teach them was walking aids. And I had to keep drilling into them that this was not an easy thing to learn. And they soon realized that when they picked up a pair of crutches, and if they'd never used them before, that this was more complex than they thought. So consulting with a healthcare professional, frequent refreshers and reminders to use appropriately. So if you're a caregiver, you may need to, give cues. Put the cane down. It should, be just right beside your other foot. Sometimes canes get lost along the way, or they're not seen well when walking. So using some bright colors, you can get some, bright tape and wind it around the cane so that it's clear and distinguishable and unique. Some canes come that way. You can buy some fancy ones, and same with the walkers. Some are brightly colored. Canes, when using canes, you're using the cane on the opposite side of the difficult side. So say, for example, my right leg is sore or it's weak and I'm just not using it well, then I'm going to put the cane on the left side. And I'm going to advance the cane when I step with that right foot, because that's going to give me the most support for that side that's weaker. That gets confusing for people because it's an automatic tendency that you're going to put the cane on the side that is sore or weaker. So that's a key thing with canes. Walkers, most walkers you see out there are the fancy wheeled, four-wheeled walkers. There's lots of them around. They have a great advantage in they're light and easy to turn. The disadvantage is that they can roll away on you pretty quick, and you must know how to brake, and it needs to be at the right height. So what is the right height for these walking aids? And again, this isn't something that always will be made clear to you when you buy a walking aid. But for a cane, if you stand up nice and tall, and that's key, stand up nice and tall, and you're going to put the cane beside your foot, and the top of the handle should come to the first wrist crease of your wrist when you hang your hand. That's the right height for a cane. So what it should look like when you put your hand on the cane is you've got just a very slight bend in your elbow. You shouldn't have a big bend in your elbow, because then you're not able to, put very much weight through the cane. It's not likely going to help you much. And if it's too low, you're going to see people bend sideways with their trunk, and that can result in back pain and other problems. So that's the right height for a cane. For walkers, it's the same thing. The height of the handles should be level with that first skin crease in your wrist. Again, you should stand nice and tall, and just a little bit back from the back wheel of your walker to just check that handle position. I already talked about walking with a cane. When you're walking with a walker, probably one of the biggest mistakes people make is that they're wheeling them too far ahead of them. And you're going to see that in that you'll start to see your posture go, and you're rounding your back, and it sure doesn't look safe. And so it's important when you're wheeling that walker that you're staying nice and tall, and it's just slightly ahead of your body, so it doesn't get in the way of the step, but it's there to give you that support. Very important that the person using the walker knows how to use the brakes, or that if not, then you're always there someone needs to be there to make sure the brakes are put on. A lot of these walkers have benches you can sit on, which is very handy, but you have to make sure the brakes are on before sitting on that bench. I have heard of many falls of that happening, trying to sit onto your walker and it's rolling. Walkers should never be used like a wheelchair. So someone should not be sitting on a walker and being wheeled like a wheelchair. They're not designed for that, and is not safe. All right, so environment, and there's lots of things. In the summer, maybe not so much environmental hazards as in the winter in Saskatchewan, but even in the summer, falls happen pretty much with the same frequency, and there's other hazards. There's rough ground, like right now there's a lot of gravel on the roads, and that can tend to get slippery if you don't see it coming. There's potholes, there are cracks, there's a lot of things out there that can be a hazard, and if you're not focused and not watching, those come up pretty quickly. I am going to talk a little bit about winter though, because it seems that Saskatchewan winter just never goes away, and we've had winter for quite a long time, even right up to when I was creating this presentation. I put in here, keep your winter tires on. You should have your winter tires on all year. And what I mean by winter tires are good, sturdy footwear. Footwear that has a back to them are not, flip-flops or sandals without a back that's going to support your ankle. And they should be comfortable with a good grip on the bottom. Running shoes don't last forever. The grips do, lose after a little while, so you need to check them regularly and really make sure you've got a good pair of walking shoes, and be diligent. When you're going out there for a walk and you think, I'm just going around the block, I'll be fine, I'll risk it. Remember to, make it a habit to put those good walking shoes on every time you head out to walk. And then walk like a penguin. So I have a short video. This actually comes from the Alberta Health Authority, but I really like this video. It just shows you a way to adjust your walking when you come to something slippery. And for us, that's often ice. And so walk like penguin is because, have you ever seen a penguin fall? No, they're pretty stable, and they have this kind of waddly gait. So I'm just going to run this for you. Okay, so from that, I hope you got it. You can actually, if you want to find that link, it's on YouTube if you want to walk it or share it with anyone else. Be low and slow and keep your feet wide, toes slightly turned out, and it's a waddle. And so I've started myself to do that. Every time I see ice, I actually walk to work every day in the winter too, and I live very close to the train bridge. If you live in Saskatchewan, you might know where I am. It gets very slippery there, and that I found that just really helps me focus in trying to stay safe. Okay, so what else about the environment and safety? So I've put up a picture here. I mean, there's obviously a lot of clutter there. Really thinking attentively and going through each room in your house and looking for what might be the hazards, what could make it the safest possible, because most falls do happen in the home. And that could be surprising to some people. You know, they think probably most falls happen outside, but they don't. Yeah, most falls happen in the home. And, you know, unfortunately, some of those falls happen for people when they're alone and then they can't get up from the fall. And that can be a real traumatic experience. So making that environment safe, looking for obstacles, consistency of furniture. So if you're changing things around, you have to just be really careful that there's a transition phase and that it's clear. Sometimes putting some like colored tape on furniture that's sticking out or that you've changed around recently can be helpful just to really identify, oh, that's a hazard, or, you know, I can use that as a touch point. Lighting is very important. Lighting, particularly in the bathroom, and a path to the bathroom from the bedroom. A lot of falls will happen getting up at night to go to the bathroom, and adequate lighting can really help to prevent those ones. Keeping useful items within reach. That's really helpful in the kitchen area for sure. So really looking at how your cupboards are set up. Are things that are used frequently in reach? What have you got up on the very high top shelves that you'd have to, you know, step on a stool that, you know, may not be the best for fall risk. And again, the footwear thing, pants that are not dragging. In the bathroom, looking at having some grab bars, handrails, a non-slip mat in the tub, being really careful about scatter rugs. And I know some rugs are very precious to people. They can have a lot of meaning, but you can also get two-sided tape and put it on the bottom so that it doesn't slip. So, you know, I don't say not allowed to have scatter rugs, but really think about the safety of those rugs. Okay, I wanted to share with you. So this was a study, and I'm just going to recognize Michaela Linz. She was a postdoctoral fellow, someone who actually came from the UK and spent a year working with me. And the study that she did a survey and some interviews actually through the Alzheimer Society. So maybe some of you were involved to ask about caregivers and your experience of falls for your loved ones, for people living with dementia, and how that has impacted you. So I'm just going to share a little bit of brief findings from that. 62% of the falls reported in the last year from the group that we surveyed resulted in injury. Now that's a lot. That certainly is not as much you would see in the general population, where you might see, 10 to 15% would have serious related injuries and end up in the hospital. 65% of people living with dementia did not remember or understand why they fell. And that makes it complex for the healthcare provider to know how to identify what the risk factors are, and for the caregiver as well. Not knowing how the fall happened, you may just find somebody on the floor and not knowing what the cause could have been, so that you can try to prevent it. From the survey, we also found that there were a very high number of caregivers that were impacted by the fall, even though it didn't happen to them. But they felt very fearful for quite a long time about falls, and constantly on edge and watching and wanting to prevent the next fall from happening. But sometimes that's not possible for you to do. The fall scared me. So there were close to 80% of the respondents. I lost sleep. It affected my health, or my own health deteriorated. And a smaller number felt supported by others. Sometimes you feel very alone. You just feel like there's no support for you. And there's certainly resources, and Karen's going to talk about a few of those at the end of the presentation. And I felt responsible. Caregivers are not responsible for the fall. Falls happen, and they often happen for no reason at all. But there is that feeling of responsibility. So here's some of the quotes that we heard from the interviews. 1 minute she was there, and the next she was on the ground, and it hit her head, her elbow, and her arm. I can see it declining. Since the fall, his dementia has really progressed, and that fall really moved the dementia on. We heard that quite frequently, that the fall often, kind of triggered some deterioration in health. And that's not uncommon in the general adult population as well. Often that fall, and I talk about fear of falls and that kind of cycle as well, but sometimes a fall, and especially if it's serious and you end up with a serious injury, can be a trigger of declining health. It took me 45 minutes before I could get her up off the floor, because she couldn't get her mind around what to do. So there are safe ways to assist somebody or to instruct them to get up from a fall. Don't try to lift someone on your own. You can hurt yourself. And be patient, I think, is a big thing. And I'll show you, there's certainly resources out there that you can watch some videos about how you can help somebody to get up from a fall. One of the things that I tell people frequently is, if you encounter someone, sometimes you're outside and you've seen someone has fallen, and the reaction, everybody usually swarms in and they want to help the person. And usually that person is feeling very embarrassed for one thing, because they're on the ground and fallen, and there's all these strangers around who are trying to help them. But the next thing that people try to do, unless that person's in the middle of the road and they're in danger, is to try to lift them or try to help them up. Let me help you. And they'll usually, come under the arm and try to help pull them up. And often that's not very helpful. And you also don't know if someone may have seriously injured themselves. So it takes a little bit of patience and just calming to check in with someone. How are you feeling? Do you feel hurt? Are any areas that are sore? And try and assess the situation, and if you might actually need to call in some help before you try to assist this person. And then it's really trying to help them to help themselves get up. And usually it's just trying to get up onto, like a hands and knees, and then getting one foot up and pushing up and gradually standing. So there's some ways to think about getting up from fall. And for people living with dementia, sometimes there's just some cues that could be helpful. Can you get yourself over to this couch and maybe get your hand on it? Push up. So some cues that might help. And then our final quote, you have to be ready to ask for and accept help. And I think that's true. Sometimes we try to do a lot on our own, and that there are resources and people who can help you. Okay, so it's time for me to kind of stop talking and for us to do a few things together. So 5 exercises, at least 5 times, 5 days a week. So these are some exercises. It was something that I came up with. I was doing another presentation for the Council on Aging for their Globe Walk presentation, and I was thinking of some key exercises I could teach them, and I came up with this acronym because I was presenting in the spring, similar to what I'm presenting tonight, and I thought, oh, plant, like planting in the garden. So these exercises are based on that acronym PLANT, so that it's a quick, easy cue reminder for what they are. And I was very grateful that Saskatoon Fire Safety, Dory Cron, kind of took up the notion of this plant, and they have now established some brochures of these exercises. They do some teaching of these exercises, and they have a video of these exercises, and so you can kind of walk through them. This is just one example of things that you can do that could help for fall prevention. There's lots of other, types of exercises, and then there may be programs that you're already involved in, and I'm not discouraging that at all. These are just some simple ones that maybe are useful for you to do at home. Okay, so we're going to cruise through them. And as I said, here's the website of where you can find the exercises and the video at the City of Saskatoon, Remember When. So let's start with the P. So the P is posture. And as I said, this should always be the first exercise that you ever do before you start doing other ones for balance, because you need to adjust your posture for each exercise. So you can do it in sitting, you can do it in standing. And tonight we're just going to do it in sitting, because I'm assuming most of you are sitting. And so some cues and things to think about. The reason why a wall is helpful is it's often just an awareness thing. It gives your body a sense of what to do. So just standing with back against the wall is sometimes a good way just to start off a practice. For a chair, you should have your back. You should have a chair back in a good sturdy chair, and you've got your back to the chair, so you've tucked yourself near the back. The key first thing is the head, and there's some cues you can use, like reach the top of the head to the ceiling, so you can think of growing tall. Think tall can be a good cue. The other one I sometimes like to use is, like, if you imagine a string pulling right from the very top crown of your head, and it's attached to the ceiling and it's starting to pull you up, what are you going to do? You're going to reach tall. Okay, so that's going to be a first cue to get yourself into alignment. Then you're going to slightly tuck your chin, and it is just a very slight tuck. You're not going down like this, it's just drawing in. And sometimes a cue I like to give people is, if you imagine a train, it's coming along a track, it's heading straight for your chin, you're just going to tuck in slightly, moving away from that train. So that's a slight tuck of the chin. So stand or sit tall, think tall, tuck chin. Squeeze shoulder blades together, and sometimes just a little bit of movement of the shoulders to relax them first, and then just squeeze your shoulder blades together to draw them back. Take a breath so that you're not bracing your shoulders, they should be relaxed. And then the final one for sitting is a slight tummy tuck. And it's very slight. It's just a slight tuck of the lower part of your tummy, just to flatten your back slightly. Okay, so think tall, chin tuck, shoulders back, tummy tuck. Okay, and hold it. And then once you've got it, doesn't have to be a static kind of thing. Then you can just try shifting a little bit. So you might just shift forward and back in your chair and keep that same posture. You might shift a little bit side to side, just trying to keep holding that posture so you get used to holding that posture during movement. Okay, so that's you're repeating that 5 times, correcting the posture, and that should start to become habit to you for the other parts of your day. Okay, the next big one with balance and strength is leg strength. And so one of the key muscles that is important for balance is the big muscles at the front of your legs. And we call those the quadricep muscles. The other important muscle around the hips for balance is the buttock muscles. And both of those are key for strength to be able to get out of a chair safely. So they're very important for function, because if you can't get safely from sitting to standing, you may have trouble getting on and off the toilet, and you need help. You're going to have trouble, being able to sit at a meal and get up safely. So it's key to independence. So I really stress this one is an important one to try and practice. Important to practice safely. So you always need to have a sturdy chair. And if you're concerned about someone might lose their balance if they're trying this, you can also put the chair back right against the wall so that it doesn't slip, or stand behind it so it doesn't slip. Okay, so there's the right way to get up from a chair, and there's the wrong way to get up from a chair. And so it's important to practice the right way, because you just make it a whole lot harder. If you're watching someone get up from a chair and you watch them really struggle and they're having to use momentum and do it several times over, it probably means that they're not shifting their body weight forward. And that could be because of balance. They may be a little bit scared and not be able to shift far enough. It could just be that they're just not aware of the proper way to do it. So first thing is, sit so the front of the chair is mid-thigh. So you do have to bring yourself forward in the chair slightly before you're doing this, and your feet have to be flat on the floor. So you're sitting, so the front of the chair is at your mid-thigh. So your back should be off the back of the chair. What you need to do before you stand up is to tuck your toes under your knees, okay, so that your feet are anchored and they're in a good position. They shouldn't be way forward. It makes it harder. And you're going to lean forward so that your nose is in line with your knees and your toes. So you have to be able to do that kind of weight shift in order to be effective to get out of the chair. If you try to stand up straight up, it's a lot harder. It's way harder for your muscles to have to work because you haven't shifted your body weight. And so that lean forward, line the nose up to the knees, and that's all you need to do to start to practice. If you can't go further than that. If you're able to, and I've got a roller chair, so that's bad, but I'm just going to show you this anyway. So as you lean and you get your nose over your knees, then you can bring your body part way up and then come down. Okay, so you're practicing that weight shift. And you may not have to go all the way up. You're just going part way up, and then you can sit back down. Then you might be able to go all the way up and sit back down. Okay, and reversing the steps to sit down. So once you are standing, you probably can't see me, but I need to bring my bottom back to the chair as I'm sitting down. Okay, so that's a slow control. Everything is very slow and controlled. So sit to stand as a practice. That's the L exercise. Ankles. Ankles are important for balance when you're in standing. Ankles are often the first joint to react when you're shifted off balance. And if you don't have the mobility in the ankles and you don't have the strength in the ankles, sometimes that will put you at risk. As we get older, we lose ankle mobility. It's part of aging. And you may notice that, you can't pull your toes up quite the way you used to. So we do lose ankle mobility. So it's important to try and maintain that. So there's a couple ways you can do it. You can do it in standing, and that helps to challenge balance and as also strength, and that's going from heel to toe. But if that's too challenging, you can also do it in sitting. And so the picture on the top just shows in a chair, lifting your foot, and you're pumping your feet up and down. And then you can also do, circles with your feet as well, just trying to get that ankle mobility. And that's an easy one you can do, sitting on the couch, taking a break, or you're watching TV, is pumping the ankles, and that can help to maintain that mobility. Ankle mobility is also really important for walking. So when we walk, we hit with our heel first, and then the toes go down. If you lose ankle mobility, often you'll catch your toe on the ground first, and that shouldn't happen. You should be able to do heel toe. So working on that ankle mobility and strength. Okay, the N is for nucleus. I had to think of an N word, so nucleus or core. So those are your tummy muscles mostly. And this particular exercise is showing like a push up against the wall. And the reason that one's helpful is to try and work your tummy muscles to kind of hold that control. The other reason that we've had it in exercise classes is it also gives you some control with your arms. And when you watch that penguin video, they talked about keeping your wings free, because arms are important for balance. They can sometimes help you regain that balance. And then also when you do fall, sometimes they're that protective mechanism to prevent you from hitting your head. It's an automatic reaction for your hands to go out. Most of us are not capable of doing like a gymnastic roll and roll out of a fall. You see that? I mean, some people might be able to do that, but most of us can't. So it's an automatic reaction. Sometimes your hands are going to go out. So that's not bad. It's just that sometimes it can also put you at risk of hurting your arms. So learning how to kind of control that descent is something we practice. So this is just showing against a wall. You don't have to. I mean, as a start, you can also do against in sitting. You could be, you could have a wall in front, or sometimes I've taught people even just a stool in front and just leaning your hands forward and practicing that push up and keeping your core engaged, keeping that tummy muscle slightly tucked as you're doing it. It's like a plank kind of activity. And you can tell your grandkids you can do push-ups. Okay, so it's all good. And then if it gets easy, you can speed it up, or you can slow it down, or you could do one-arm push-ups. And a tip is to keep the elbows tucked in. Okay, the final T. T is for tree and tandem balance. So one thing that we have found with research is that in order for balance to get better, you do have to challenge it. And so it's not enough just to practice balance in sitting. If you're someone who's out and about and you're walking in the community, you have to also practice balance in positions that make you a little bit unstable. So, but do it safely. So there's ways to practice it safely. Tree is like a one leg standing position, standing on one leg. And not all of us can just do that in the open air and without anything to hang on to. So you need to have a steady, sturdy chair in front, or have a wall. To be really safe, you can put yourself in a corner with a chair in front. So then you've got a wall on each side, you've got a chair in front, you're not going to fall in that position. And then you're just basically practicing, and don't get discouraged. Maybe you can't quite get on one foot, but you might be able to just shift your weight a little bit and get onto the toe of the other. A goal would be to practice standing for 10 seconds on one leg. And that's kind of a gold standard for people who are out and about in the community. If you can stand for 10 seconds on one leg, then that's pretty good balance to be able to balance yourself in certain situations that you encounter. The tandem stand is one foot in front of the other. And the reason that one is helpful is it really challenges that lateral balance. And so you can practice one left foot in front and then the right foot in front. And again, if you start getting really good at it, then you might try to lift one arm at the same time. So there's ways to try and challenge that as well. Okay, so again, I'll just recognize the Saskatoon Fire Department, and there is a phone number there as well that you can call. Okay, so we're getting to the point of the final messages before we go for questions. So first of all, know your risk factors. Watch for patterns, times, and places where risk tends to increase. Evenings sometimes can be, higher risk time for some people than others. Respect that falls do happen. Avoid self-blame, but don't ignore and seek out resources and support. And plant yourself. Practice balance daily, stay active, and get help when needed. So I have some resources here. I mentioned the fire prevention, and anyone can access that information. There's lots there. There's also a video on how to get up from a fall. The Staying on Your Feet program. So that is in Saskatoon. I do believe they're venturing out into some other communities now as well. That's run through the Saskatchewan Health Authority. The Council on Aging, they actually are running a program right now out of the field house. It's based on an exercise program I've been doing with my research called FAST. And if you want more information about that, you can contact them. And then Forever in Motion, and that's provincial. There's lots of Forever in Motion sites across the province that you can connect into and get involved. And of course, Minds in Motion as well. And they have both a virtual and in-person program through the Alzheimer Society in Saskatchewan. Okay, I'm going to turn it back to Karen.
Thank you very much, Dr. Arnold. That was a really informative, interesting presentation, as well as we learned some practical plant exercises and tips, and so we appreciate that. I hope you all feel, as participants, more confident in your knowledge around falls prevention after hearing the presentation. You will receive an email with a copy of the presentation in the next day or two. So you'll see all the links on that presentation for the websites. We will soon be answering questions. We're going to do that right away. And so you can enter them into the Q&A box. If you haven't typed them in yet, we encourage you to enter them now. And just a reminder that questions must be relevant to the topic tonight, and the presenter won't be giving personal advice. While you're entering your questions, I will share, and while you're thinking about them, I will share just a few slides on the Alzheimer Society. And so first of all, the slide that's up right now is about the vision of the Alzheimer Society. It's to live in a world without Alzheimer's disease and other dementias. And the mission is to empower all people to live well with dementia while funding research into prevention, cures, and quality of life through advocacy and awareness. With Alzheimer Society resource centers across Saskatchewan, in the 2021-22 fiscal year, we served 2,400 individuals from 300 communities across Saskatchewan. A couple of things to note: a person does not need a formal diagnosis to be connected with us, and we support those affected by Alzheimer's disease and other dementias, and have resources and knowledge about many types of dementia. So now we'll talk about this slide. Support changes everything. So what can you expect from the Alzheimer Society of Saskatchewan? I'll also call it ASOS. You can expect individualized connection and service, individual information and support available for both people living with dementia and their care partners. Learning opportunities, including learning series courses to help people with dementia, their families and friends to live as well as possible with the disease. The courses offered build upon each other, covering the continuum of the disease. And we also have evenings of education, such as tonight. There's standalone topics presented by content experts. We have connections. You can build connections through support groups. Our support groups offer a chance to exchange information with others living with and affected by dementia, access the most current information, learn and share practical tips for coping with change, to decrease feelings of loneliness and isolation, express feelings and be reassured that these feelings are normal, and find a sense of hope. And Dr. Arnold also mentioned Minds in Motion. That's one of the programs that the Alzheimer Society has. It's a 2-hour weekly program that combines physical activity and social activity for those with early stage dementia, and a friend, family member, or care partner to participate with them. We also connect you to other organizations. This includes providing information to you on other available services provided by the Saskatchewan Health Authority, other government agencies, lists of private or community-based organizations that help support you in your dementia journey. Our shift to also offering virtual and online programming has increased our ability to provide additional programs to our communities. And if you have questions about dementia or need someone to talk to, you can see the number on your screen, the province-wide toll-free dementia helpline phone number. It's available Monday to Friday, 8:30 a.m. to 4:30 p.m. Next slide, please. Knowledge changes everything. Let's talk briefly about dementia research. The keys to progress lie in investing in dementia research, revealing the mysteries of the diseases that cause dementia, and advancing diagnosis, treatment, and prevention. All research stimulates hope for the best life. The ASOS funds research in partnership with the Alzheimer Societies across Canada through the Alzheimer Society Research Program. Alzheimer Society of Saskatchewan depends on the expertise of the ASRP to allocate research dollars to innovative peer-reviewed projects that focus on finding treatments, causes, and cures, and improving the quality of life for people currently living with dementia. Saskatchewan research is vital to advance opportunities and enrich the best possible life for Saskatchewan people whose experience involves dementia. ASOS depends on the expertise of the Saskatchewan Health Research Foundation to allocate research dollars to peer-reviewed projects in the province. Next slide, please. Did you know that 3 out of every $4 the ASOS receives comes from donations? Donations inspire hope to provide early diagnosis, greater awareness for new medications and treatments, to provide strategies for coping, to provide care partners the confidence in their abilities, and to continue to serve Saskatchewan communities with support and resources that are reflective of your needs. Donations come in during events such as tonight as sponsorships, gifts left in wills, monthly donations, or as general donations to the society. Next slide, please. Please take a look at our Alzheimer Society of Saskatchewan website. There's our programs and events webpage. It lists upcoming event information. You will note our dementia helpline phone numbers also listed on this slide.